Welcome back, everyone. On our last episode, we talked with Dr. Jasline Moreno and Dr. Elizabeth Wells-Beede about nurse educator competencies and the transition from clinical practice to academia. So thank you for joining us for part two.
What I always go back to is the systems issue. This is a huge systems issue, and I think you offered two solutions. But then you think about, like, I was in a course on health equity and anti-racism, and the solution was mentoring. But how do you support the mentor in terms of release time, getting them prepared for a role such as that, because it is a formal role that you need some kind of orientation and socialization to. And what system issues, are there related to mentoring? Is there protected time? Do they have release time? Is this acknowledged for their career growth and things of that nature? Because a lot of times, like I think about my mentors, it's always been informal and they've been nice enough to, take the time to help me here and there, but it's not a formalized role. So how do we institutionalize that to make sure we have systematic support built in, and and also making it equitable for community colleges, for university, everyone, because I come from a community college background and we don't have that structure always. So how does that look, and how do we make it formalized and really operationalize this process? Even when we talk about professional development, are there funding, And then when there is funds, like I ask people, hey, how come you're not coming to this conference? They're just busy. They're overwhelmed, right? So how do we make it happen for them? I think all of us, we've kind of had this affinity to simulation, so we've had some similar mindsets and we were pursued. But how do we get the other elements, the other pieces of it?
I think that's a really great question. I think that's probably one of the big elephants in the room, because if there isn't that support for both the mentee and the mentor, then you are placing more burden on the person that's mentoring, because you can't make an automatic assumption that just because they are a senior member of faculty that's done amazing work, that's done pedagogical research, that's like, somebody in the field that's just a Marilyn Orman, for instance. I think you do place an unintentional burden on them as well, because then you're uploading what you're expecting them to be doing, right? I think it's a call probably, and I think that ends up being that catch-22 again, because if you don't have enough funds to be able to support the professional development or the release in time, because you have a shortage of faculty and you can't accept enough students. I think it's really hard, because it ends up being this perpetual circle of really constantly chasing our tails, right? Of truly what is, and I hate the adage, what came first, the chicken or the egg, but you're never able to find the solution, because there's always something that's circularly coming back that's like, oh, well, now this is a problem, or now this is a problem. I think a big part of it is administrative support. I think that's one of the bigger things. You really have to be able to have a dean or deans that are going to be really truly committed and really saying that this is how they want to structure it, and this is what they're going to do, and have that ability to then really try to pull it up that chain of systematic structures. Because really some of it does come down, a good chunk of it comes down to funding, right? Maybe it's even if you're like within a small institution and you do have a big group of faculty that are onboarding and coming in, is it fiduciarily responsible to send all of them to a conference? Or is there some way that you could possibly do some type of a mini conference, bringing people to them, and do, something within your regional location? And even with that, sometimes when you do something like that, there could be the opportunity to really not necessarily get money off of it, but to be able to support it by, sending the option out to some of those other regional areas or local areas. Because for me, I think of basically within Texas, the state is so big. We have so many rurally underserved areas. And I mean, that would be a great opportunity if somebody wanted to offer some type of educational session, you know, down in the Rio Grande Valley, to where they may not have as many opportunities or funds because they are in a rurally underserved area, that then they could come to that regional location to be, you know, to be getting those opportunities for education and services. Because it's really, I mean, even for somebody from the Rio Grande Valley to come all the way up to Fort Worth, where I'm at, that driving wise, that's a good 8-9 hours. I mean, that's how big the state of Texas is. Maryland could fit, we could fit a couple of Marylands here.
But I do think it's important, though, if organizations want to increase the number of faculty that they have to invest in them, in the faculty, because what I've seen is the other side. You hire all the faculty, you don't have an established, structured, orientation for these new faculty. And what happens? They get frustrated, they get burnt out, and they leave academia within a couple of years. So I think that you have to invest, and have a plan too. One thing I did appreciate about my first nursing education position was there was a structured plan. Like, you were assigned a mentor when you walked in the door. You had to sit on the curriculum committee for 2 years. You had to sit on the test development curriculum. I don't even know if universities still have these committees. I might be dating myself, but I learned so much. At first I was like, oh, we're being forced to, but I needed that. And I learned so much from just being a part of those committees. And also when we need mentors. That was brought up. I don't know where I would be if I didn't have my mentors, and people that have a strong foundation in education. But they need to be, compensated for that, whether that's money, whether that's, I remember when I was in academia, part of my yearly evaluation, it did ask the question, are you mentoring anyone, not just students, but faculty? And that was part of your evaluation. So they need to get credit for that work that they're doing. But I think that piece is so important, to have a mentor that you can bounce back and say, can you take a look at this syllabus? Can you help me decipher this test? And I remember the first test analysis. Remember, you got the data and I was like, what do I do with this? What questions do I need to change? Throw, all those discussions. You have no clue what you're doing in nursing education. So I just want to stress that piece is really important. What about, we talked about it's important for the organizations to support faculty, but also I think some of it maybe needs to be self-directed. So what advice would you have for someone, let's say that their institution, they send them to that conference and maybe they have a mentor, but what else can faculty do that, is more proactive, that they can do on their own to kind of meet these educator competencies? Suggestions do you have?
I think one of the things that I did a while back, and had some amazing educators that kind of pulled some of these things forward. And even though sometimes it can be extremely like blah, because it's theory, but it's really looking at research and information that is outside of nursing. And so a lot of times when I would start looking at maybe trying something different, I mean, even when I did my dissertation, I looked at something outside of nursing, to look at really, and dating myself now. So my research was on the flipped classroom and educators' perspectives of the flipped classroom. And so I intentionally went outside of nursing to really see where education was at, especially in that K through 12 area, because those are who come to us. And so I think in order for us to be consistently in a place to where we can help become better educators, and as a faculty member, we need to be okay with looking at literature outside of our own profession, because many times, especially when it comes to teaching practices in nursing education, we're behind. We're very behind. We're really, I mean, I can't express that enough. We are so far behind. I mean, when you still see somebody that's using a PowerPoint presentation in a classroom, we really kind of end up, we do it to ourselves because we're so familiar with what the practice is. And it's easy, right? I know so I taught our OB course, or our maternal child courses, because I'm an obstetric nurse at heart. And I went back to that, right? You go to a PowerPoint because I knew all the stuff about being an obstetric nurse. But the unfortunate thing is our students don't need to know what I know. They needed to know what they needed to do in order to be able to do it more appropriately. So I think you need to be you truly do need to be a lifelong learner. You have to be okay with looking at things that are completely crazy and off the wall. I always say, and it's one of our values here at University of North Texas Health Science Center, is to question the conventional and to be okay with failure. Because if you're not okay with failing, you're not going to be innovative. Because somebody that's an innovator at heart is okay to question why it's being done the way it's being done, and to start looking around the corner for an innovative solution as to how we can improve it. And I think that's also the same thing as you were saying. We're simulationists at heart. And I think that's probably that we're all those innovative thinkers, because we always questioned, well, why are you doing it this way? Let's do it this way. We always tried to find those ways for our students to really truly grasp what they need to do. And I think feedback is a big thing. We don't do, I don't think personally, in my experiences in academia for the period of time that I've been in academia, I don't think we truly do a really great job of assessing and receiving feedback, whether it's peer feedback or student feedback, with an evaluation type of process that's going to be appropriate, that's going to be useful, that's going to help us improve a course. And a lot of people don't teach their students how to do an evaluation, because they think it's an evaluation that they're going to be able to just completely disintegrate the faculty member because they didn't get the grade that they were getting. Well, what onus was on you to receive the grade that you thought you earned? So were the objectives truly clear? Did you meet the objectives of the course? Did the faculty help guide you to those objectives? And really setting up an evaluation and feedback model that actually will also help feed a faculty's evaluation. Because I think that's where some of that back and forth is as if we're very intentional in a trajectory of how we're professionally developing, everything should align from point A to point B. And I think we struggle with doing a really good job at that.
I think I echo everything you said, Elizabeth, and I'll add a couple of things that came to mind. I think one of the characteristics that you need to have is that you need to be able to be a self-advocate. As you come into this profession, I've noticed, a lot of senior educators will just assume, you're okay until you say like you're struggling or there's an issue that comes up. But meanwhile, as a novice educator, you've got this internal turmoil. You're like, am I doing this right? And I think you've got to be able to ask for help and say, I'm not sure. How do you write this exam question? What would you know? And that takes a little bit of intellectual humility. A lot of our educators, our practitioners who transition to educators are experts. So they've been oriented, they've been, the top of their career. And so to come in all of a sudden and say, hey, I don't know how to do this, I've seen that challenge, and I think you need to acknowledge that, yes, you were an expert, but now you're kind of starting off in a new role. And there's got to be that intellectual humility and say, I'm not sure how to do this. I can do all these other things, but when it comes to writing this exam, like, darn it, I can't get it. And asking for help. I think those two characteristics are essential, for you to thrive. Just like, if I have a new nurse who's on the unit who's not asking questions, I'm worried, right? And I feel the same way about a new educator. And even my peers who are, who are seasoned educators aren't accustomed to that. And I think we need to say it's okay. Like, yeah, they've been in the field for 40 years. They should have questions. It's okay for them to have these questions. And then I always tell my nurse educators, whether they're, new or seasoned, be curious. Like we understand you're intelligent. We understand that, you've done all these things, but in the classroom, be curious with your learners. And that will help drive that connection that you might be missing, that engagement. So those are the three things that always come to mind when I think of characteristics of a good educator. I don't think it's going to be someone who's super intelligent or super, I want someone who's curious. I want someone who can ask for help. And then who's always willing to learn. It goes back to that lifelong journey. Like there's always something we as nurses are going to be learning, and having that intellectual humility to say, pause and be like, okay, I'm going to listen here. there's someone else who can do this a little bit better. I'm going to ask for help. So those things I think are important.
So
Yeah,
as we wind down, I have one last question for each of you, because I think about how we were taught and how this generation is different. We hear that all the time. We were okay with as my mentor says, the talking PowerPoint, death by PowerPoint. But like I think you said, Elizabeth, this is a generation that needs to be engaged. They need interaction, because they can lose their interests like this. So how do you envision the role of nurse educators evolving in the next 5 to 10 years? How do we need to maybe change to meet the needs of just a different generation of learners?
I can start off yeah. So I'm just coming off the conference. Kelly presented a wonderful presentation on AI. I just signed up my kids for something lingo off of Khan that uses AI to help, personalize their learning. I really think we need to leverage AI. Like we're sitting here talking about item analysis, writing questions. How can we use these technologies to really help our educators so that we can spend dedicated time doing research or mentoring or all these other pieces that we need? I think if we keep layering on the expectations for educators, it's not going to help. So we've got to find ways and innovative ways to really help resources, build that rich, treasure chest of resources, so then we can take on these new roles. All of us can be mentors, all of us can be researchers, all of us can attend all these wonderful conferences because we have resources that are going to help do our job. And I'm not an expert in AI, Kelly, but I think that will be the future of education, is really looking at how we can leverage it to the best of our abilities to do things that will, make us more effective and more impactful in the other areas. So that's what I'm hoping for. I'm looking forward to more detailed instructions on how to do that.
Yeah, I think I'd have to agree with that. And then it just adding a little bit more to it in that. So again, remember I said I typically go to where teachers are teaching students that are K through 12, because knowing that those are the ones that are always going to come to us. So again, looking at the technology, what is there? That was kind of how when I started doing some of my research with VR Sims, and that's what I had seen, is that kiddos were being introduced to virtual reality, and we weren't doing it. And so I knew that really, what is that on that? And I believe it was Dr. Love that said it's what's on the bleeding edge instead of the cutting edge. In that, not only the matter of and it may not even necessarily be embracing technology, because we don't all need to be champions of AI, right? I don't think any of us has the bandwidth to all be the champions of AI, but I think to recognize that it's there, and how are we going to utilize it within our practices, and understanding as well as to what the scope is for those of our students that are going to be going into the profession, and what does that look like with them using some of these technologies coming forward. And one of the things that's been really hitting hard for me is that the last couple of leadership conferences and leaders that I've been hearing within nursing is that I think for me, within the next few years, with the way that technology is advancing, I'd also like to see our profession advance a little bit more. I'd like to see more nurses at the table. I'd like to see more nurses in those leadership roles and informing really what that looks like, because without us at those seats, it's going to get informed for us. Right. I mean, one of the things that Dr. Love has spoken about at a number of conferences is really how nursing looked back at a time that we were part of that payment structure. And now we're not. And our voices are really muddled, and other people are answering those questions for us. It's kind of like when you have an architecture come into, and we say this all the time, right? You go into a hospital unit and you're like, who designed this? Like, was there a single nurse in this conversation? Because the gloves are 500 feet away, and I'm like not even being a good steward of my time in this room, because I have to go around a bed 5 times because the equipment I need is on that side when it should be on this side. And I mean, I think if we're not at the tables to really say what that AI development or technology looks like, it's going to get defined for us, and we're not going to be there.
That's powerful. We have to have a seat at the table.
Yeah.
So we have unfortunately run out of time. I think we could have gone on and on and on with this conversation for a couple more hours. But I just want to take the time out to, number one, thank you both, because I know you're both like me coming off of a conference and had quite a busy day. So I appreciate you taking the time out to have this very important discussion, because this is a hot topic. And like you said, there's gaps that we need to close. We got to figure out how to do that. And a lot of that comes with, making sure we have the resources for these nursing educators, making sure we have mentorship, and also just re-envisioning the way that we deliver nursing education and prepare our learners. So again, I want to thank you, Dr. Elizabeth Wells-Beede, and also Dr. Jasline Moreno for helping me to have this important discussion. And I stay tuned for our next podcast. So thank you again.
Thank you for the invitation.
Thank you.